Well, we're here talking to Dr. Diez, a dentist in Tampa. How are you doing, Dr. Diez? How is life in Tampa?
Very good, Helmut. How are you?
Good. Dr. Diez, look, you're a dentist, and there's lots of dentists out there, and as people who are not dentists, we kind of we're not so sure how to pick a dentist, and to some degree, we think a dentist is a dentist is a dentist, and at the same token, we also believe, and I'm sure there are some differences. So tell me, what kind of is your philosophy in your office? What is kind of some of the main points you emphasize, and perhaps even tell us what made you becoming a dentist?
Well, I'll start with what made me become a dentist.
Okay.
I really idolized my dentist as a child. And I grew up with his son, so I saw him at many events in addition to his office. And again, I really admired this man. Very down to earth, just a really good guy. And I sat down in his office one day with him, and we talked, and I knew really early on, I think I was 10, 11 years old, that I wanted to be a dentist. I wanted to have a practice like his. So,
right.
I'm sorry, go ahead.
No, I just want to say it's good to, it's good to be doing business with people who, they do it out of conviction. There's something which drives them in that field rather than doing an analysis which field can be making better money. That's the one I go into it.
Well, that's the other thing, Helmut. My family, they're mechanics. Everybody's worked with their hands, and I'm doing the same thing. I'm working with my hands. A little different than my grandfather, who was an auto mechanic, but I'm still working with my hands. It's just everybody in my family has that talent. I enjoy what I do. I really love it.
Great. Now, in terms of treating patients, in terms of philosophy, never mind necessarily equipment. Most dentists are relatively up to date. But what's your philosophy in your office? You must have one.
Well, I treat every patient just as I would want to be treated, or I treat my mom, my dad, and my brother. We truly believe that the mouth is the gateway to overall good health. It's so key to overall good health, and that's where we start. From that point, we sit down, we talk to the patients, and we like to hear what they want to get out of treatment, because everybody has something different that they want out of treatment. And I like to blend that with how I feel they should be treated, and we talk about it. I tell them what's best for them. They tell me what they desire, and we reach a goal that we both want to get to, and that's where we go.
Right, because I'm sure there's a kind of a mixture, a combination, or a some type of trade-off sometimes between getting the most beautiful, gorgeous, potential smile a dentist can provide. Maybe a Julia Roberts smile, a Tom Cruise smile. I'm not saying they have fake teeth. Maybe they do, maybe they don't. I wouldn't know. But they do have these $1 million smiles. And, you guys can do that. However, it also costs money and it things. So basically, there is functional dentistry. Makes sure that the body, as you said, the body is the gateway to the rest of the body. I mean, the mouth is the gateway to the rest of the body, be it the kidney, the liver, the heart, and so to make sure that a person stays healthy, looks reasonably good, almost like you have a nice dress on it. It's not a $3,000 dress. It's a $100 dress, but it looks good. It's not shabby. It's not dirty. And all that. So is that kind of like what you just said, what you're trying to do?
That's right. I mean, I always look at the health aspect first. Helmut, a lot of times, it goes back to form follows function. A lot of times when you make the mouth healthier, you also make it a lot more attractive. That's not to say that sometimes we don't just do cosmetic work on a patient, but from a dentist standpoint, from the way I was trained in school, we look at the health aspect first, okay? And then we can focus more on cosmetics. Now, sometimes people come into my office and they're in perfect health and they just want to look better. Well, that's great. That's very simple to do. But again, it goes back to form follows function. A lot of times when we make someone healthier, it just happens at the same time. Their mouth looks a lot better.
Right. Absolutely, I'm sure it is. Well, thanks a lot. I think we learned a lot. So I think we know where you come from, wanting to be a dentist since the age of 10 and then achieving your goals. So for all purpose, you're already in heaven. Dr. Diez, we'll talk to you more about some specific procedures if you don't mind.
That sounds great.
Wonderful. Bye-bye for now.